So Flex Health Solutions, how would you describe that entity to our viewers, just to get a baseline, and then from there we can talk about the expertise that it brings to the market?
Absolutely. So Flex is a contract design and manufacturing organization. We're one of the largest in the world. We have over 30 medical device manufacturing entities. We do everything from automotive to industrial, consumer health, to medical. So I'm the Chief Technology Officer, and it's my pleasure to be here. Thank you for having me.
So that's interesting because I've been in MedTech for 32 years and always followed Flex. And I wonder, do you have the benefit of having some of those technologies be leveraged into MedTech that you learn in automotive, that you learn, in industries outside of MedTech?
That is one of the strengths that Flex has, because we're able to look across the aisle at what's coming. We know that health solutions or healthcare, it's a long life cycle. And so you see consumer devices, automotive, they move at a much faster pace. Innovation moves at a much faster pace. So we're able to look across the aisle and see what's coming. So optical is a great example of this. Some of the sensor technology are things that we share as part of our centers of excellence within Flex. So the medical device segment, we're able to leverage that knowledge bidirectionally throughout the organization. So it's a great opportunity, and when you partner with somebody like Flex, you have the benefit of really tapping into a broad range of expertise and capabilities as a result.
Over the last few years, I'd say 7 to 10, I've watched a lot of contract manufacturers really become technology leaders, where historically, if you went back 15, 20, 25 years, respectfully, people went to contract manufacturing to sort of slow it down, go to pasture, lifestyle, no pressure. But in the last 5 to 7 years, maybe even 10, the excellence and sort of domain expertise that has come into contract manufacturing in an area now, especially in the sensor world. You mentioned optics. Have you seen that? Because you came from industry and went to Flex, and you went from owning a product, making a product, bringing a product to market, to now a Flex. Where does that intersect now with the trends in MedTech?
Yeah, absolutely. So by design, we are starting to build core capability and competency of people who have come directly from the product world into design and manufacturing, to be able to speak the language of our customers, to understand the pain points because they've walked the same paths. So I see that intersectionality of the capabilities that are being outsourced, right? As you said, previously it might be just we want to have some of our external capabilities kicked out to another manufacturing house. Now it's coming to a true partnership, and especially in the last few years, I think there's been a accelerated appreciation for the depth and breadth that can come with the partnership, a true partnership. Not just a service agreement, not just go and do this for me, but this is what I crush, this is what we as a product company do really well, and you Flex, or you contract design and manufacturing house, this is what you crush and you do well. Together we can do something extraordinary. And in fact, Flex, their tagline is create the extraordinary, and our CEO, Revathi, she stands behind that with everything she does by infusing the core capabilities, the talent, and the strength behind those words.
It's very apparent that centers of care are shifting, hospital at home, brick and mortar, trying to address especially that chronic disease state, which is 80% of that 19% GDP that's being spent every year in the US. How does Flex move into that space in regards to technology superiority? Are there some specific technologies that in-house you crush it?
Yeah, absolutely. So you talk about decentralization of, and we see, like I said, an acceleration of that. Treatment, diagnostics, therapeutics. So Flex has a core capability within drug delivery systems, connected devices, right? CGMs and diabetes management, on-body infusion pumps, digital health. So bringing all of those core capabilities with optical, miniaturization, resiliency of the supply chain with our design for sustainability, core capability. Those are the places that Flex crushes it. We have a huge portfolio, both within our design and our manufacturing centers that we've worked with these types of products before. in addition to our own internal projects, we are investing in cutting edge technology to ensure that we are delivering value to our customer so that they can de-risk faster. We walk the path that they have, like I said, and so we can help them get to market faster.
Coming into Flex, year and a half, 2 years ago,
Yeah.
you had a different lens, because some people do have careers in contract manufacturing. They do, they will roll from one to another and bring their skills that's needed. But to get a leader who's the CTO, coming from an OEM, and then coming into Flex, what were the aha moments for you, your first 6 months or so, that you're like, you know what we aren't doing and we should be doing, or what are we doing that we probably shouldn't be doing? And so what were those aha moments your first, from a career perspective?
Oh, I love this question. When I was on the product side of the house, I was working with, or I have historically worked with contract design and manufacturing houses. And so when this opportunity to join Flex came up, I knew the value of working with somebody. I used to talk about, I loved working with contract design and manufacturing because they had to eat their own lunch, right? I knew that they would be infusing that manufacturability mindset from the very beginning. And within my own internal R&D team, sometimes you can be too close to the problem. And so by zooming out a little bit, bringing different perspectives, bringing different expertise into the equation, it actually helped us move faster and de-risk more efficiently and effectively. So my aha moment coming over to the Flex side is just the tremendous validation of talent and capabilities. For me, it was very eye-opening. So I was deeply entrenched in the critical care, point of care world, and just how many opportunities there are for intersectionality with digital health, with connectivity, with 3G and IoT, all of the sensor work that we've done, how they can be leveraged across a broader spectrum. So that was tremendously invigorating, exciting coming over to Flex, and it also validated some of the experiences that I had previous to coming over with Flex.
So without giving away any secret sauce or any brand names, what are the trends you're seeing in MedTech over the next couple of years that became clear in the last 2 years between all the supply chain issues we've had, pandemics, geopolitical influences? What do you see being an area of focus in MedTech?
So we'll start with value-based care, outcome-based medicine, right? So connecting the data, the tremendous amount of data that's being produced by these instruments, by these devices. Historically, it just evaporates into the ether. You get your information and it goes away. Now moving to turning that into insights and opportunities to change behaviors, to change the way that we do medicine, I think is incredibly interesting and important as a trend. Where Flex plays into that is, again, those core capabilities where we really crush within optical, digital health, connectivity, all of those types of devices. So those trends of decentralization, moving further and further out of the core hospital and into near patient care, point of care types of places.
Finally, I'd be remiss if I didn't ask this, because TMG is the #1 search firm in the world. What do people get wrong about looking at opportunities at contract manufacturers now that you've been on the product side and now you're leading a CTO, probably the industry's largest? What do they get wrong, and what should they look at, and why should they look at a Flex to come to work as an engineer?
Within Flex, the sky is the limit. There is such possibility to move up both with exposure for scope. If you come in as an engineer within the health segment, right? You have exposure to the medical, to the automotive segment, to the lifestyle segment, to all of the other different areas. Within Flex, we have more of an insular, we're going to talk to each other, we need to leverage the strengths that we have, we need to leverage these capabilities we have in order to be effective. So when people think about a CDMO, a contract design and manufacturing organization, I think they think it's just manufacturing heavy. Of course, it's about maintaining supply chain and quality and sustainability, and by design, Flex crushes that. But there are so many other things that you can do on the design side, on the innovation side, and on really helping people change the conversation about patient health, about patient outcome?
I'm an engineer. Once you're an engineer, you're always an engineer. I'm going to imagine too, you get to rotate out of new products a lot quicker. Because invariably when you're on the classic OEM side, you're sort of with a product, you're staying in that product, R&D, V&V, manufacturing, let's bring it back, Gen 2, Groundhog Day, so to speak, right? But I bet I get a lot more looks at new technologies and new methodologies at a Flex.
100%, 100%, and breadth, the breadth of scope. So we're looking at, in order to help our customers, we're looking at the market ourselves. We're doing deep dives into market trends. We are going out and just like our customers, we are talking to clinicians, we are talking to practitioners to find out what their pain points are so we can follow along and get out ahead of the trends so that we can help our customers think about what's coming next. How can we accelerate you? How can we get you there faster? So absolutely, we can be a true partnership because of that broad lens that we're applying across all of the different segments.
So I would get as an engineer, clinical interface, potentially UI, UX, right? Leading edge, because if I understand what you're saying, I can get that exposure, because then as either Bob's medical device comes in or one of the big strategics comes in for a partner, you're going to bring in, as you mentioned, you guys crush it in optics, right? So I would get that subject matter expertise I could share with my client, that if not but for. Interesting.
Yeah, absolutely.
Well, listen, I appreciate your time. I know you've got a busy conference ahead of you. Thanks for sharing the Flex story and CTO leading the organization.
Thank you very much. I appreciate the opportunity. Pleasure meeting you.
Thanks.
All right, cheers.
I'm Joe Mullings from AdvaMed 2022. Be well.